Hello, friends. Today we're going to talk about obesity-related disorders. So let's look at some of the learning goals we have today. After reflection on this presentation, students should be able to discuss the relationship between obesity and various health conditions. Draw conclusions between obesity and occupational performance. And finally, formulate interventions that occupational therapists can implement to help individuals with these conditions. So let's talk a little bit about the health risks associated with obesity. Obesity is a chronic medical condition that is generally defined as having a body mass index, or BMI, of 30 or higher. Obesity has several associated health risks, including heart disease and stroke, high blood pressure, diabetes, certain cancers, osteoarthritis, particularly of the knee and hip, gout, depression, obstructive sleep apnea. Please keep in mind that being obese does not mean the person will have these associated conditions, but the risk rises if the individual has a family history, has struggled with obesity since childhood, or has other risk factors for one or more of these conditions. Let's take a closer look at some of the conditions that are linked to obesity. Now, I think we all know that obesity has a strong connection to heart disease and stroke. So obesity does have a strong link to cardiovascular disease. According to the American Heart Association, obesity increases risk for high blood pressure, high cholesterol, atrial fibrillation, stroke, heart arrhythmias, congestive heart failure, and most significantly, to sudden cardiac death. Here are some interesting hard facts. In 2022, over 702,000 people died from heart disease. That equates to about 1 in every 5 deaths in the United States. Coronary artery disease is the most common type of heart disease. And heart disease is the leading cause of death for men, women, and people in most racial and ethnic groups. It affects everyone. Now let's look at some facts about stroke. Approximately 795,000 Americans have a new or recurrent stroke annually. About 90% of stroke risk is due to modifiable risk factors. And as we know, obesity is a significant risk factor when it comes to stroke, which is why it's so important to try to control our weight. Here's some more information about cardiovascular disease. In 2020, cardiovascular disease accounted for about 930,000 deaths in the United States. Between 2017 and 2020, about half of the U.S. adults have some form of cardiovascular disease. The total cost for cardiovascular disease in 2020 was about $417 billion. Cardiovascular disease is mostly preventable with lifestyle changes. That means people can significantly lower their chances for heart disease, stroke, and heart attacks by losing just a few pounds. It also means that gaining just a few pounds can increase the risk for these diseases and conditions. Another important obesity-related disorder is type 2 diabetes. Obesity is a major risk factor for type 2 diabetes. In fact, people affected by obesity are about 6 times more likely to have high blood sugar. And according to the American Diabetes Association, obesity is a significant risk factor for type 2 diabetes, and treating obesity is the cornerstone in the prevention and management of type 2 diabetes. In fact, weight reduction leads to prevention, control, and in some cases even remission of diabetes. How important is it then for people with diabetes to control their weight? Some more interesting facts about type 2 diabetes. Among the U.S. population overall, estimates for 2021 were about 38 million people of all ages, or about 11.6% of the U.S. population, had diabetes. About 38 million adults age 18 or older, or about 14% of the U.S. population, had diabetes. And 8.7 million adults age 18 or older who have diabetes are not aware of it. They're undiagnosed diabetes. That number represents almost 4% of all U.S. adults and about 23% of all U.S. adults with diabetes. The percentage of adults with diabetes increases with age, reaching about 30% among those aged 65 or older. It's a significant disease and a significant problem in our country, and it can be controlled if obesity was controlled. Of those individuals with type 2 diabetes, almost 90% are overweight or have obesity, defined as a body mass index, or BMI, of over 25 kilograms per meter squared or higher. Broken down, that means about 27% were overweight, with a BMI of between 25 and 29.9. About 47% had obesity. That's a BMI of 30 to 39.9. And almost 16% had extreme obesity, which is a BMI of over 40. Here are some things we know. Type 2 diabetes leads to chronic kidney disease and possible kidney failure. It leads to eye-related problems. As a matter of fact, diabetes is a leading cause of blindness in adults. Type 2 diabetes leads to neuropathy. That's nerve damage, particularly in the lower extremities. Type 2 diabetes leads to foot problems. Nerve damage and circulation issues can lead to foot infections, cellulitis, and even amputations. It's actually quite common. Diabetes also increases the risk for stroke, heart disease, hearing loss, and skin breakdown. As if diabetes and heart disease weren't enough, according to the National Cancer Institute, cancers of the colon, breast after menopause, endometrium, which is the lining of the uterus, kidney, and esophagus are linked to obesity. Some studies have also reported links between obesity and cancers of the gallbladder, ovaries, and pancreas. The prevalence of obesity-related cancer is devastating. In the United States, more than 693,000 cancers in 2021 were associated with obesity. That's about 5% of new cancers in men and about 10% in women are due to excess body weight. The percentage of cases attributed to excess body weight varied widely across cancer types, but it was as high as 51% for liver or gallbladder cancer and about 49% for endometrial cancer in women. and about 49% for liver or gallbladder cancer, and about 30% for esophageal cancer in men. As you can see, excess body weight plays a significant role in cancers for both men and women. So why is obesity such a risk factor when it comes to cancer? That's a good question. Obesity is linked to chronic inflammation, and that can affect the immune system. Obesity can also lead to hormonal imbalances, such as increased estrogen levels. Growth hormones can be elevated in people with obesity, which can also cause cells to divide more often, and that increases the cancer risk. Another obesity-related disorder is gallbladder disease. Gallbladder disease and gallstones are more common with excess weight. Gallbladder disease affects approximately 25% of Americans. That's 1 in 4 people in this country impacted by gallbladder disease. Overnutrition, or overeating, contributes to obesity and stone formation due to an increased cholesterol secretion. Obesity can increase the risk of gallstones, gallbladder cancer, and gallstone-related complications. And from what I understand, gallbladder or gallstones are quite painful. Let's talk a little bit more about gallstones. Obesity can cause higher levels of cholesterol in the bile, and that can lead to gallstones. Gallstones are actually hardened deposits of bile that form in the gallbladder, often without causing symptoms, but they can lead to complications like inflammation, significant pain, or blockage of the bile ducts. People who are overweight or obese may have larger gallbladders that don't work as well. Importantly, rapid weight loss can also increase the risk of gallstones, which is why any kind of dieting or weight loss program should be supervised by a professional. Let me talk about gallbladder cancer for a moment. Obesity is strongly linked to increased risk of gallbladder cancer, especially in women. Gallbladder cancer is a highly fatal cancer. It's often diagnosed late. It metastasizes quickly, often has few symptoms, and is difficult to treat. And for that reason, its survival rate is only about 20% after 5 years. Another common and painful obesity-related disorder is osteoarthritis. Osteoarthritis, or OA, is a common joint disease characterized by the breakdown of cartilage, the protective tissue that cushions the ends of the bones. Obesity is a major risk factor for developing OA, particularly in the weight-bearing joints such as the knees and hips. Osteoarthritis is a common joint condition that most often affects the knees, hips, or back, sometimes the neck. Carrying extra pounds places extra pressure on these joints and wears away the cartilage. That's the tissue cushioning the joints that normally protects them. Weight loss can ease the stress on the knees, hips, and lower back, and may improve the symptoms of osteoarthritis. So what are the mechanisms of osteoarthritis and obesity? Well, let's take a look. Increased mechanical stress. Obviously, excessive weight puts increased pressure on the joints, leading to wear and tear. We also must consider altered biomechanics. Obesity can cause changes in gait patterns and joint alignment, further stressing the joints because we're just not walking appropriately. Inflammation. We know that fat cells in obese individuals produce inflammatory substances that contribute to cartilage damage. Finally, there's oxidative stress. Obesity is associated with increased oxidative stress, which can damage cartilage and promote inflammation. Let's take a look at the risk and severity of obesity and osteoarthritis. Obesity is a strong predictor of osteoarthritis development and severity. In fact, individuals with a body mass index of 30 or more have a significantly higher risk of developing osteoarthritis compared to those individuals with a normal BMI. The severity of osteoarthritis tends to increase with increasing body weight. The converse is true as well. Less body weight, less severity of osteoarthritis. So what is the treatment and prevention for obesity and osteoarthritis? Well, weight loss. Losing even a small amount of weight can significantly reduce the risk of developing osteoarthritis and slow its progression. Physical activity. Regular exercise, especially weight-bearing activities, can strengthen muscles around the joints and reduce stress. Medications. Anti-inflammatory drugs and pain relievers can help manage osteoarthritis symptoms. Joint surgery. So in severe cases, joint replacement surgery may be necessary. Obesity is a major risk factor for osteoarthritis, and reducing body weight is an effective way to prevent and manage this condition. By understanding the mechanisms and consequences of obesity on osteoarthritis, individuals can take steps to protect their joints and maintain mobility. Another obesity-related disorder is gout. Gout is an inflammatory arthritis that occurs when an individual has too much uric acid in their blood. The extra uric acid can form crystals that deposit in the joints and cause pain. Normally, uric acid is eliminated through the kidneys, but kidneys in overweight individuals work less efficiently, putting them at higher risk for gout and at a younger age. Also, how a person carries the weight matters too. Those individuals who have excess visceral weight, that is, they have more belly fat, are more likely to develop gout. Experts suggest that this may be because visceral weight produces more of the inflammatory chemicals that can trigger the disease than does subcutaneous fat, like fat on the thighs. Another obesity-related disorder we're going to talk about, sleep apnea. Obstructive sleep apnea is a narrowing of the airway during sleep. A BMI that is above the overweight level, which is 25, can be a risk factor for obstructive sleep apnea. Approximately 45% of individuals with obesity have obstructive sleep apnea. Sleep apnea can make it more difficult to breathe at night. And people with sleep apnea tend to snore heavily and briefly actually stop breathing during sleep. The condition may also cause sleepiness during the day. In addition, studies show people with sleep apnea have higher incidence of heart disease and stroke. In the adult population, the prevalence of sleep apnea is estimated to be approximately 25%, or as high as 45% in obese subjects. Weight loss often improves sleep apnea. So what's the common thread we see here? Anytime we go to our doctor, he or she is going to talk about several things we can do to keep ourselves healthy. Of course, he or she will tell us not to smoke. By the way, that means don't smoke anything. Just saying. Don't smoke and don't drink excess alcohol. Get regular exercise, maintain a healthy diet, and watch our weight. These are controllable factors we can do to avoid a host of medical conditions that can be deadly. A common thread running through these medical conditions we've mentioned today is excess weight. As occupational therapists, we're going to have to remind individuals of those same things we hear from our physicians. And very importantly, we will work with overweight and obese individuals to find ways to help them live their occupations to the fullest. Thank you for your attention today. For more information on any of these topics, please feel free to check out the references listed here.